Welcome back, everyone, to Einstein's Eyes. I'm Carl Rosen, oculoplastic surgeon in Anchorage, Alaska. It's great to have you back. I'm here with my friend, my former co-resident at Albert Einstein, Jon Ditkoff. And we have a guest lecturer that is my partner at Geneva Ward Surgery Center. We really are glad to have him. Chad Bouchard, he's a retina specialist. So first, I'm just going to let Jon introduce himself, then Chad, and then we're going to get into macular degeneration from a high level, just to go over simple methods of diagnosis and touch on treatment, but really make a further video on treatments for the wet variety and the dry variety. Jon, take it away.
Hey guys, so I'm in New Jersey. Carl and I trained together at Albert Einstein, hence Einstein Eyes. So it's nice to see everyone again. I specialize in the front of the eye, although I do general ophthalmology. So I do see a lot of macular degeneration. And in my practice, we have a retina specialist when it gets to that point that requires more specific treatments. But I'm very, very interested to hear what the Alaskan guys are going to teach me today.
All right, yeah, my name's Chad Bouchard, originally from Northern Maine. I was a health profession scholarship program recipient, served 8 years in the military, which brought me to Alaska. Did my residency with Madigan Army Medical Center and then fellowship at Albany Medical Center. And so here to talk about the two varieties of macular degeneration. There's the dry and there's the neovascular or the wet variety.
Yeah.
The fundus photos of a normal retina, you can see the nerve, the vessels. The macula is the area that is all encompassing within those large blood vessels. We call the arcades. And right in the middle is called the fovea, and that's the area that's responsible for us being able to see 20/20. And predominantly the area that gets involved in macular degeneration is this region called the macula. The two varieties that exist are the dry form, which we see in the presence of these yellowish deposits called drusen. So drusen is kind of a normal aging variant. And we see this drusen, the presence of drusen in normal eyes. When it becomes more of a pathological variant, and that's by and large, the byproduct of age-related macular degeneration is the presence of drusen. And where drusen are located, they're right below the cellular layer called the retinal pigment epithelium. Drusen are these waste products. So as these pigmented cells try to get rid of waste products, it can't keep up. So it starts to build up within the layers of the retina. Risk factors that exist: smoking, obesity, high cholesterol, all those are specific risk factors. But by and large, the other thing that we see is genetics is a big component. And typically this is in Caucasians. As this condition becomes more advanced, then we start to see cell loss. And cell loss is when we go into the more advanced stages where we have atrophy. And atrophy is that retinal pigment epithelium where those cells essentially start to die. And so you can see this area, this large white patch, and that red area below that, that's actually the blood vessels underneath the retina that we can see. Now, unfortunately, when we undergo atrophy, that's when we have that profound loss of central vision that doesn't come back, unfortunately. And so when we have the dry form, we can have that more advanced stage of the dry form, which is the presence of atrophy. And then there is another stage where we have the neovascular version, where blood vessels actually start to grow underneath the retina. They penetrate through. It's kind of like weeds growing through a crack in your layer of concrete. And as they grow, they start to leak, they start to bleed. And what they leak is they can leak serous fluid, clear fluid, they can leak blood, they can leak fatty cells or lipid. And this is what's responsible for really devastating vision loss.
Yeah. So Chad, can I just jump in? So that was great. And I just want to remind the audience that the vast majority are dry. The American Academy of Ophthalmology says 80%. It's probably more than 80%. And then the wet variety is about 20 to 10% or so of folks. Would you agree?
Yeah, that's right. That's right. And by and large, this is what we see as retina specialists. And it's a profound disease burden worldwide. 1 to 3% worldwide, are affected by this. And so as that aging population, as the baby boomer population continues to age, we see this more and more and more. So it really has a significant impact on socioeconomic factors as well.
Right, and that's why the new treatments are really so wonderful for folks. And we're going to talk about that on another video. But that was great. Hey, listen, thank you for your service. You were a major in the Army. And,
yeah, that's right.
And we're grateful for your service. So, hey, this was wonderful. John, any last words?
Yeah, I guess I would add, I mean, because I do general ophthalmology, the conversation I have oftentimes with patients is I'll see them with very mild drusen, or even a little bit more, where I think it's the early signs of macular degeneration, where I see it progress. And I think for most of my patients, they don't really lose vision. I mean, that's the good news. I think most people do well. I think obviously for Dr. Bouchard, it's a different practice. He's seeing the people where they really are having a lot more difficulty. A lot of them require treatments. One thing I would ask you on this video, I think it's worth it. So if you see someone with early macular degeneration, what is your opinion on AREDS 2? Because I know years ago we recommended it to everybody, along with protect your eyes from the sun, leafy vegetables, don't smoke, don't age if you can, eat a healthy diet. But I think I always recommended AREDS 2. And then my retina specialist, probably a few years ago, said, no, it's really only being recommended for moderate to severe macular degeneration now. How do you feel about that?
I mean, honestly, I'm not sure. Maybe that's more of an opinion. I'm not sure that that's really peer reviewed, because the peer reviewed aspect of it is within the age-related eye disease study, which is AREDS. The two arms. The second arm just changed the formulation a little bit. Was the effectiveness was shown for the early to the intermediate stages, and those stages are really defined by the size and the presence of those drusen. Which we can get into the weeds on that, but we can measure them and measure the exact microns, and then that delineates where we're at. So generally speaking, when we see them in that intermediate to more advanced stages, and so pretty much everyone's on AREDS vitamins at that point.
Agreed. Yeah. Thanks.
All right. Yeah, great. Well, listen, as I said, fantastic discussion. Thank you, John. Thank you, Chad. I've been wanting to have you on the show for a while.
Yeah, nice to meet you, Chad.
But we'll do this again, and we'll have Chad talk about treatment for the dry form and the wet form. And
great.
We'll see you guys on the next one. But thanks for being here.
Great. Thank you for having us. All right.